Hi everyone, and welcome to another video in relation to sport and exercise psychology. In this video we'll be looking at the psychological factors that affect people in exercise environments. So we've discussed in previous videos personality and motivation. Wanted to talk a little bit about how different psychological factors may affect people in exercise. So we're going to be looking at why people exercise in the first place, what barriers there is to exercise out there, determinants of exercise, and understanding the behaviour change models. So, why do we exercise in the first place? Well, for health benefits, these relate to weight management, again, reducing cardiovascular illnesses, and overall reducing mental health. Related illnesses such as depression, stress, anxiety. Exercises, research is out there now about how exercise can help all these mental health issues. From an enjoyment perspective, we do this because we enjoy doing exercise, and also women and young people are more likely to report enjoyment as an important factor when exercising because they're enjoying it. Self-esteem as well. People take part in regular exercise because it helps or plays an important role in building up a person's self-esteem. An increase in self-esteem is a result of achieving goals as well, and by achieving these goals you're going to increase your motivation, but also at the same time you're going to start reducing your mental health because you're more confident in it. You're now more confident, your self-esteem's built up, and it can help reduce your stress levels, it can help reduce your anxiety levels. For that reason they can have a knock-on effect. So again, if we look at a social reason as well, again, people often start exercise programs as a way to meet new people and interact, especially if you've moved to a new area. Exercise is probably one of the good ways to get or meet new people. It's due to this reason that people take part in group exercise classes. So again, there is now new exercise classes coming out every day that incorporate exercise with new mothers. Reports would show that new mothers would be at home while their partners would be going to work, and they become isolated. So now we've taken that exercise back because we're getting them back into shape, and they want to increase their self-esteem again after giving birth. But again, there is no childcare. But what they can do is they've created a group that incorporates exercise with new mothers. So not only that, they get to socialise too with the other new mothers that have just had children. And one of these ways, one of these new classes that I've saw, which I think is absolutely fantastic, is going for a run or a jog while pushing the prams as well. So they're pushing the children in these push chairs while jogging at the same time. And alongside that, so you've got these groups of mothers with push chairs running, especially in my area, along the beach, along the coastal area. And again, they're interacting with the new mums and they can share their experiences and how things went. And again, have a think about if there's any other reasons why people want to take part in exercise. Now, if we look at barriers, they can be broken up into 5 main headings. We've got the physical. This relates to a person not exercising due to an injury, disability, health, age and weight. It's said that men give a physical reason to non-participation more than women. So more men will say they have a physical injury due to them not participating. Another one can be emotional as well. These relate to fear that can be related to health. An example is they fear they might be getting injured if they start exercising. It could also be due to the person being too shy to take part. So again, think of that personality aspects. So somebody might really want to start exercising, but the personality, because they're quite shy, does not want to go to a local gym because they have a fear of being almost judged. And again, they don't want to be seen in a big crowd, they want to be left alone. So maybe you should be incorporating some exercises where they can do it on their own. The other thing that recently we can look at is people have started jogging a lot more, which is fantastic. But look at it from a personality point of view, someone that's quite shy. Would they want to be running around their street where people can see them? Again, this could lead to my next point. They could be just too embarrassed. Again, if somebody has got an excessive amount of weight and wanted to start losing it, they may feel quite conscious and embarrassed by the way that they look, and going into a local gym they might feel that they're judged for the way that they look as well, and the same as if they're running, they might feel embarrassed, that they might almost be bullied to an extent, so they don't exercise. Again, it can be broken up, we've said. Motivation, this relates to people not having the commitments to maintain participation in exercise due to other factors in relation to another barrier. Most common motivational barriers are needing the time to relax, needing to rest in their spare time. So a lot more people, especially if you are under pressure at work, will say the reason why they're not exercising is because when they have the downtime, that's their time to just sit and relax. And actually we probably should be exercising at this point. However, they see the factor of work life is the work is overtaking them, so when they do get that chance to rest, they're taking it with both hands. Time, another reason, most common barrier to exercise. Most people, if you ask them why don't you exercise, they say I just don't have the time in my busy schedule. And again, this can be linked to other factors such as work and transport. They might say, by the time I get to the gym, I'd only get 10 minutes in, so actually it's not worth it. And again, the cost could be that as well. However, this is perceived by a person not to have the time. This relates to work, family commitments, but don't people just have time to sit and watch TV as well? Think about half of you that are now sat here watching these YouTube channel videos. Could you be doing something a little bit better? If you're doing it for your work, fantastic. If you are thinking, I want to know a bit more about psychology, that's great as well, but could you be doing something else? And availability. This is related to people's finances, facilities and equipment, and other people to exercise with. So again, some people would want a friend to come with them to exercise. Another one is some people just can't afford the cost that it is to go and exercise within a local gym. It's quite expensive nowadays. However, could this also be seen as an excuse because our council's now incorporating gym equipment into parks? That's another way of taking down that barrier of cost and equipment. So factors of exercise adherence can be broken down as well into three headings. Adherence means continuing on. So personal factors, this includes demographic variables such as income and education. So people might not take part anymore in exercise due to obviously the income, we've said the financial strain, education points of view, not really understanding the benefits about it. Cognitive variables such as motivation, and finally behaviours such as past history of exercise. So again, if someone's had a real negative experience of exercise, it may affect them later on carrying on with it. And again, this could be going into a gym, just as simple as going into a gym, trying to lose the excess weight that they have, and somebody is staring at them, pointing, laughing. That could have a lasting negative impact on a person that will stop them going into another gym. Environment, again, this includes social environments such as support of friends and family, and physical environment factors such as weather outside. So again, if it's quite cold outside, people might look and go, well, I'm not going to go for a run, it's too cold to go for a run out there. Again, so those are particular comments that you would hear in that sense. We then got activity. This relates to factors including groups and individual activities, and frequency, intensity and duration of the exercises. So again, if you've got someone that's just starting out in exercise, you're not going to put them in high intensity exercise. Let's have a think about this. Everyone at the moment is so big on that HIIT training program. However, that's high intensity interval training. That's massive amounts of work for someone just trying to get into it. Now, if you're pushing that exercise program onto somebody that's just starting, psychologically that's going to have a negative effect on them. It might have a complete opposite, we don't know. However, we can look at it from both angles. Some people could find it very motivating, high intensity makes them feel like they've actually achieved something at the day. Other people might actually find that it's too difficult to do starting out because their fitness levels isn't up to that stage yet, and they take part in it, and by the end of the session they're going, oh my god, I do not want to do this again. Is this what all exercise is like? I'm not doing any form of exercise. And again, think about how long you're doing it for. We do have recommended requirements here within the UK, so think about what the government guidelines recommend for physical activity. And again, someone starting out, if they have excess amounts of weight, are we expecting them to do 40 to 45 minutes worth of exercise? Probably not, because again, think about it, if you've got excess weight on, that's extra weight that you've got to try and carry while exercising. It's going to be quite difficult, it's going to be quite demanding, and it can lead to a negative experience. So if we look at the behaviour change models, we've now got the trans theoretical model. This is where the health belief model and the theory of planned behaviour are used to try and explain exercise behaviour. So the trans-theoretical model, this is also known as the stages of change model. This model suggests that to change a behaviour, individuals must go through a series of stages in order for that behaviour towards exercise to change. And what we mean by that is pre-contemplation, contemplation, preparation, action, maintenance and termination. These are the phases or stages that they need to go through. It's said that people go through these stages several times when trying to change their behaviour. There can be an additional stage which is known as the relapse. This means when people fall back from their current stage, they're going to relapse into this stage. Relapse can happen at any stage and the individual begins the cycle again. So the pre-contemplation phase is obviously, as we're saying, we are looking, at starting to exercise. We want to exercise and we're thinking, right, how are we going to do this? Contemplating, pre-contemplating, we're not really thinking about it. Contemplate, we're now starting to think about exercising and improving our health and getting to that place. Preparation, we might start looking at where gyms are, what's the prices, what's the opening times, thinking about, can I get it done? And then the next stage is the action stage. So you actually start going to the gym for the first time and start exercising. Maintenance, again, you're maintaining that level, and then finally the termination when you're finishing it. The relapse stage, like it says, can fall into any aspect here. So again, you could be in that action stage, you've done it for the first time, and then another barrier comes in, and all of a sudden you've hit that relapse, and you've now gone to the pre-contemplation stage. You could be in the maintenance stage, something happens to you, your finances change, and all of a sudden you now use that as an excuse to stop going to the gym or even exercise internally, so you've relapsed. And that is basically how we explain the changes to behaviour towards exercise. So I hope that you've got a lot out of this video. Again, we've talked about barriers to why people don't exercise. Have a think about it. So when you're now discussing this in your assignments, if you're thinking from a past level, you're just telling me or identifying barriers. So again, time, money, that sort of thing. If you're explaining it, you do it a little bit like my slides. So you'd say they're split into different categories and give me examples of where these situations occur. So like I've said, when I've talked about financial, you could say, lack of funds because of the cost of gym memberships. And then when you talk about this behaviour theory, just like I've done here, you explain this model, what it is, what are the different stages, analysing it. Again, we can talk about, if we talk about financial point of view, so they can't afford a gym membership, actually, is that just an excuse? Could we find an alternative, such as going jogging on the street, that sort of thing, that costs us nothing? And that's you analysing it. Does this theory, do you agree with that theory that I've just talked about? Is there stages? Is there less than those stages that you think literally it is just contemplating, doing the action, going for the start, maintaining it? Do you not think we need the other ones? Do you agree that the relapse section should actually be put on there and clearly identified of what that means? So have a think about that, and that's you analysing it and getting your distinctions.